Hi friends, I have the honor of introducing to you Dr. Chirag Bhanu Singh. He is a DAMS regular course student for MCI screening and he has passed this MCI screening exam with flying colors. He has a score of 184 in this exam. So Chirag, how are you feeling today?
Sir, I'm very glad right now and very happy to pass with such a good score.
Was this your first attempt?
Yes sir, it was my first attempt.
So were you happy with the fact that people tell that this exam is a more tough exam and less people pass, but you were able to do it at ease in first attempt? Was it a surprise, a pleasant surprise?
Yeah, actually sir, yeah, a lot of people made it like a big thing, but it's not that tough. I think it was my first attempt and I think the paper was not very tough and it was all from the notes which I studied at DAMS, and yeah, it's not a big deal. Everyone can do it, but what they have to do is this: during this 5 or 6 months period, if they are doing coaching, then they have to be 100% dedicated. They have to give every second, every minute.
So you were a part of the regular course program that we have in DAMS for MCI screening.
Yes sir. Yes sir.
So how did you utilize those classes? Like, what was your approach in the classes? Like when you went to the class, what was your approach like? Were you listening to the teachers intently? Were you making notes? Were you asking them doubts? What was your idea about the class?
Actually, I remember first day class. It was Rajiv Dhawan sir, and he was fabulous. And at that day, I realized, like, yeah, this is what I need in order to get a good score, and it helped me a lot. Our classes were like 12 hours. And after that we used to go home and study everything which we have done throughout the day and revise all of it. And I really kept the thing very simple. Just keep revising every day, and after every week I've scheduled how to do the revision and that stuff.
So if I say that your goal was to attend the class, make notes, then go back and read them once.
Yes sir.
That was like religiously you followed.
Yes sir.
And did you give tests also that were periodically?
Yes sir, and that helped me a lot. After finishing a subject, DAMS used to conduct a test, and there's a test and discussion, I would say, and that was really helpful in the questions which we couldn't solve, and the teacher will tell us about those questions, like what different method we could have approached to get the answer and new concept, and that was really helpful, sir.
And did you also appear for the CBT that we conducted in a computer center with a simulated environment?
Yes sir, yes sir. Actually, I would like to share one thing. During the last 1 month, I was like a bit depressed because a lot of subjects to revise, and I don't know whether I'm going in a that direction or not.
Yeah.
So I wanted something to analyze myself. So at that time, DAMS conducted 2 CBT, and that really helped me a lot. I gave that test. I was so nervous, but when I got the result and it was good, then I came to know, like, yeah, I'm going in the good direction. So I kept the momentum and keep on studying more harder, and I achieved.
So if I may, put it in like, words other than that, like, I personally believe that, this MCI screening exam is a qualifying exam. Yes. Many people, they do not understand the significance of this. When it's a qualifying exam, you don't need to compete with each other. You just need to pass the exam. So to pass the exam, you need to have basics of all subjects with you. And sometimes I see, instead of focusing on basics, people focus on repeat questions. They try to buy guidebooks, they buy resources, because inherently everybody of us is tuned to look for ready-made solution. But at the end of the day, this is an exam. There is no ready-made solution for it. You have to understand the concepts, and to understand the concept, you have to come to a classroom.
Yes.
When you come to a classroom, you meet teachers, you listen to them. They, and because in DAMS we have, each teacher is a different specialist in his own field. So they talk about their own field. They help you to visualize that thing, and but then that doesn't end. Then you have to read it yourself that you did it, and yes, then you have to test yourself to understand where you're lacking.
Yes sir.
Then again read it, and then in the end there should be a mock test which simulates the real exam. Then that gives you an idea. Okay, this is how the field.
Yes sir.
So did the real MCI screening feel like a CBT to you, or like a DAMS paper to you?
Yeah, almost same sir. I almost scored the same in the CBT.
Yeah. So did you enjoy the simulation that we could create?
Yes, sir. Definitely, one should give that CBT. There were few of my friends who didn't give CBT. Yes. They were like, time waste. हो जाएगा, preparation करना है. I'd say like, it's okay, I will give this. And it helped me.
Yeah, because that's very important to understand, because I have seen over the years many people, they shy away from the tests. They say, Arey, abhi I will study and I will give a exam later on. But any exam that you give for the first time, you are bound to make silly mistakes. Yes. You have to practice before that. Because you have to see, even in sports, even big cricketers, football player, whatever, they are playing the big match. Before playing the big match, they try to play a lot of practice matches.
Yes, sir.
And so that they get a hang of the thing when they play the big match. Otherwise, they will be rusty. And when you are rusty, you make mistakes, and silly mistakes are the one which will end up, getting you at 148, 145, and then you will regret that why I did not do the practice for the test, why I was 5 more marks and you could be out of this game.
Yes, sir.
And I feel that, these are the prime reasons for the, overall the MCI scheme, the passing rate is not so good.
Yeah.
One is that people are looking for ready-made solutions in form of guidebooks, and, people are selling them hard also. And when you get this guidebook, you get the impression that I have to mark them up. While in the real exam, you have to apply.
Yeah.
And coming to that, I also want to know from you, you have given this exam.
Yes, sir.
Now, can you, review that exam for us and for the future listeners who are, going to give the exam? How was the exam like? Was it more conceptual or, visual? What was your impression of that exam?
Actually, sir, the first paper, as I think, according to me, it was, I found like 70% of the questions were directly from the notes. But yeah, there was no one-liners though, but there were a lot of questions from the first paper that was directly from the notes, and I can recall, oh, that is from that page, and teachers were really nice in those notes. And the second paper was a bit like conceptual. They have linked 2 or 3 subjects together, and like pharma, surgery, radio together, and it was good, not that tough, not at all. But one thing I would like to tell you, that students must focus on their concept, building their concept, rather than cramming those one-liners, because it's no more one-liner game. You have to build your concept, and then you can easily do it. It's not a big deal, sir.
Yeah, and especially when if you notice that there are a number of questions in this exam which are visual, and there are questions which are integrated. So when you look at integrated questions, so what happens is you have to think a little bit on the day of the exam.
Yes, sir.
You can't say that, somebody will spoon feed me, I am just mugging up this word and this word will come same to same in the exam. It doesn't happen like this. So once you understand the things, you are able to add them in the exam and look at the choices.
Yes, sir.
And often I have seen there will be questions that you will need to rule out in the exam.
Yeah.
Not every question you can get directly.
Yes, sir. Yes, sir.
So what was your strategy in the exam about ruling out?
Ruling out. Actually, yeah, in few of the questions I was like confused between 2 or 3 options. So like 1 I can rule out, 2 I can rule out, but I'll be stuck in one or 2 options. Then you have to recall all the things, smart guess sometimes.
Yeah, this is very important. Smart guess is also very important.
But you will get the smart guess only when you have studied.
Yes.
You have the concept.
Yeah.
So you can use
it is very important to understand there is nothing smart without studying.
Yeah.
It's very important to understand. Some students come to me, sir, what if I guess it? You cannot guess it till the time you have the baseline understanding of the things. And how to make that? By working hard, by listening to teachers intentfully. Yes, I believe majority of the learning will be done in your classes itself. When you are learning with the teacher, the things get imprinted.
Yeah.
They start echoing in your mind.
Yes, sir.
And they come back easily in the exam. And then you have to be smart enough to apply it in the exam.
Yes, sir.
Yeah. And how did you tackle the visual questions in the exam?
Visual question. Actually, a lot of few questions were radio and from the radio. And actually, it was very basic questions, not very high level. Very simple questions which we have already studied in the class, and few were from the Dharma, and Dharma teacher have taught us very nicely about the, and surgery and radio combined. So it was good, sir.
Yeah. Did you enjoy giving the paper?
Yeah.
So
I was really nervous before the exam, but while giving the exam, I was like, "Ye to kiya hai."
And so when you enjoy the exam, I think the results also speak.
Yeah.
I think that works like this. Now, any particular teachers in DAMS that you would like to mention today, or you remember today, on this day?
Mir Chandani sir and his notes and the way he give class, it's awesome. You know, he speaks and it gets imprinted in your mind. And gynecology, I really focused on the gyna and obs, because actually a few of my subjects were like, I was weak in two or subjects, so I read them once or twice. But after that, what I did, I give more time to the subjects which I already knew, so that I won't leave any question in the papers, so I can compensate. So my study was that. And anatomy, sir, his diagrammatic explanation was awesome. Yeah. And one question was there from directly from the diagrams. Yes, sir.
Yes. I think the gastric artery one.
Yes, sir. Yeah. And physiology teacher, you know, ma'am. Direct questions from the physio. Yeah.
So were you happy with the way, you know, the teachers have taught you?
Yes, sir. Very happy.
So, you know, how would you, you know, define the role that dams played in your getting the score?
I would say they played a major role in getting, like, you know, where I am right now. So it really helped me. The notes are the main thing. Many people will tell you, read this book, take this book also, take this also, do this question. No need, I'm saying. According to me, I just stuck to the notes. That's it. And after that, I just give this CBT and all. And that's it. You need not to overdo things. Just stick to the basic, you will get it there.
And you have a total, you know, maximum 6 months time.
Yes,
if you overdo it, you will end up messing it up.
Yes, sir.
It's very important to understand. Second is that one advice that I want to give to everybody is, do not miss out on tests that we conduct. Yeah. Please give CBT. And last time I saw some students, you know, they were, you know, registered for the CBT. They could come, but they said, I'm studying. So I said, what study will you do at home?
Yeah.
What is more important than learning how to give the exam? So
yes,
you have to come to the center, give the exam, and that learning is invaluable.
Yes, sir.
And what you will make some silly mistakes in the damn CBT, that is important, but that will prevent silly mistakes from happening in the real exam.
Yes,
this is subtle exam skills that you have to acquire.
Yes, sir.
But some skills you can acquire only when you go to give the exam. You cannot acquire those skills sitting at home.
Yes,
you have to go to give the exam, show up, and that is the way you actually do it in the first attempt. And here we have Dr. Chirag with you. His score of 184, first attempt, he has cleared the exam with ease. And if you notice, the simplicity in his approach was, he had faith in the system that he had joined. He had faith in his teachers. He made sure that he attended almost everything in the classes, did all the tests. If we told him to attend a CBT, he attended both of them. He had faith in the system that I have to do this. And at the end of the day, when you have faith in a system, you follow them more sincerely. Yes. Otherwise, what happens is, you know by now that, there will be people advising you to do this, that. Thousands of books are available. They say, read this book, and most of them are poor compilation of previous questions. That means, although they claim to be a compilation of previous questions, but nobody has a previous proper recall of MCI skinning. They are, made up questions here and there, and you end up, mugging them up, and in the end, you don't find them in the exam.
Yes, sir.
What would you say about the, repeat questions in this exam from any previous paper?
No,
this was an absolutely new paper, I think.
Yes, sir. There was nothing from the old.
Yeah.
So
that clear understanding is the key here. I hope, with these interviews, our goal is also to, tell the future aspirants that suppose, some of you are right now studying abroad. You are, thinking about MCI skinning at your maybe a second year stage or a third year stage. It's good to make concepts. Good to learn your subject rather than, targeting a guidebook and, thinking that, okay, I have bought this guidebook, this will get me through. It is not like, you have to understand things clearly. And that is how this exam, works. And gradually, we know the government of India is looking at an exit exam. So once the exit exams comes for everybody, again the basic philosophy will remain same of making concepts. You can't just say I'm mugging up only a few lines and pass it. That will not happen. So I hope you get the hang of it through these interviews. That is our goal of conducting this interview. Now, Chirag, I also now want you to ask you to give some message to future aspirants. Any message that you want to give to any future aspirants?
Actually, I'll say like every student who is preparing for the FMG right now, those who are in the college or university or those who are in the coaching, that keep things simple. If you are following a coaching, then stick to the notes. They are enough. And one thing is that you have to do hard work. You cannot get it like just reading one-liners, just 1 month back, just take a one-liner and read it. It won't help you. And that's it.
And with this note, I would again like to congratulate you on your achievement. I'm sure we are seeing the beginning of your achievements. I'm sure you will come back with more achievements in future.
Yes, sir.
And I'm sure that you will rise and shine.
Thank you.
I also want to utilize this opportunity to congratulate your parents.
Thank you, sir. Thank you so much.
And your family. I'm sure for every one of them, it is a landmark.
Yes.
Heartiest congratulations on everything.
Thank
God
you,
bless
sir.
you.
Thank you,
I
sir.
wish you all the best for future.
Thank you, sir.
Congratulations.